Well, there's 250,000 drugs, pharmaceuticals in the PDR, the physician's desk reference, that they have access to treat people in America. There's new ones coming out all the time. They're always bragging about how many billions of dollars worth of research they spend every year to find new drugs. And if you take out the 500 antibiotics, that still leaves 249,500 drugs. There's not a single one of those designed to cure anything. There's not a single drug in the PDR, except maybe antibiotics might cure a strep throat. Other than that, there's not a single drug in the PDR that cures anything. They're all designed to milk your insurance policies. They're all designed to milk Medicare and Medicaid. They're all designed to milk your wallet, because there's no laws requiring the pharmaceutical companies to manufacture drugs that cure, even though they could, but because there's no laws requiring them to do it, they don't. This just came out in January of this year. Health spending has biggest surge in 11 years. We're going to jump right over here and say, U.E. Reinhardt, a health economist at Princeton, said, the increase in healthcare spending is no surprise. This is what the American people asked for when they abolished managed care. What he said there was this. For about 8 years, the cost of health care stayed the same when there was managed care. Doctors didn't like it because managed care kept them from doing unnecessary tests. Managed health care kept them from doing unnecessary surgeries and writing prescriptions for unnecessary drugs. And they didn't like it because it cut their income in half. They weren't getting the kickbacks anymore. And so they began to whisper to their patients, you know, there's an economist, there's a bookkeeper making decisions what tests you should have and what drugs you should get and what treatment you should have. It should be my job. I'm the doctor. It should be my job. And after a while, people said, yeah, it should be the doctor's job. Why is some bookkeeper doing that? And so they convinced the American public that managed care was no good, and so people then complained to their legislators, who then voted it out. And, of course, their workplaces went to other things other than managed care. And immediately, when managed care got dumped, healthcare doubled and tripled, and it's just going up like a skyrocket because now there's no controls on the doctors. Well, how does this affect us? This came out in May of 2003. Age 65 plus workforce rose sharply since 1980. Americans are living longer and they're fretting about their financial security. What is the biggest reason why people are worried about their financial security? Healthcare. Healthcare, right? Healthcare is the biggest thing that people worry about. As you get older, you need more healthcare. And there's all kinds of things happening because of healthcare. Doctors always get paid. You're going to pay it. Your employer's going to pay it. The government's going to pay it. They don't worry. They're happy, right?